30% of us carry the MRSA bug, but we don't have any signs or symptoms of it. And it usually colonizes in our nose. So if you go to the hospital sometimes, they'll do a swab in your nose just to see if you're carrying it. It's really important to notice the early signs and symptoms of MRSA on your skin. Like the pictures show on those handouts, they'll be red, swollen, painful, there could be pus and drainage. It really resembles a spider bite. It's very similar. It most often occurs from cuts or abrasions and on areas of the body that are covered by hair. You can also have MRSA in your lungs, your bloodstream, and your urine. But usually those kind of MRSA infections happen while you're in the hospital during the stay. So that's not something you really would probably get unless you're in the hospital. Okay, if you come in close contact with another person's skin that has the MRSA infection, you can get it. So you don't want to share personal items like towels or bandages. Any kind of openings in your skin, MRSA can find its way in. Contaminated items and surfaces, so you want to kind of Clorox in your environment. MRSA can live on a surface anywhere from 16 hours to 4 days. So it can last a while. Poor personal hygiene, which touches back on what they talked about, and crowded living conditions. If you do have MRSA skin infection, don't try to treat it yourself. I know it's hard not to want to pop it, drain it yourself, or disinfect it, but that can make your infection worse and you can spread it to others more easily. If you have a skin infection, the doctor will usually just drain it and give you some antibiotics to treat it. You can prevent getting MRSA by washing your hands thoroughly with soap and water, using the alcohol-based sanitizers. Clean your cuts and scrapes, keep them covered with a dry bandage. Avoid contact with other people's wounds, and don't share your personal items. Does anybody have any questions about MRSA? Sound pretty good? Okay, now hepatitis C. Does anybody know anything about that?
Is that like the herpes on your lip or something like that?
No.
Or not the same thing?
No. Hepatitis C is a contagious liver disease. You get it from being infected with the hepatitis C virus. It can vary from being very mild to very severe, and it can be acute or chronic. So acute hepatitis C is a short-term illness, and you usually start showing the symptoms within the first 6 months after you've been exposed to it. Chronic is the serious one. It's a lifelong illness. You can have a lot of complications. It is the leading cause of cirrhosis and liver cancer, and the most common reason for a liver transplant in our country. We'll talk about exposure and transmission. I printed out a separate handout for that because it's very important. A lot of people don't know. Toxins, drugs, heavy alcohol use, and bacterial and viral infections are causes. Hepatitis C is spread through blood of an infected person. So sharing needles or other drug equipment, needle stick injuries in healthcare. You can be born to a mother with hepatitis C and acquire it. Sharing your personal items like a razor, anything that comes in contact with blood. Sexual contact with an infected person. It's very rare, but it does happen. And even tattoos if poor infection control is in place. The scary part about Hep C is that 70 to 80% of people with it have no symptoms. They don't know they have it. But if they do have symptoms, it can be fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice. Does everybody know what jaundice is? Your skin will start to yellow, the whites of your eyes will yellow. And if you are going to have symptoms, they usually show up 6 to 7 weeks after you're exposed. But usually, since there's no symptoms, people catch Hep C that they have it through routine blood work. Okay, the treatment for acute hepatitis C is just rest, adequate nutrition, and fluids. If you have chronic Hep C, they use two meds called interferon and ribavirin. Not everybody has a good benefit from those drugs. They have serious side effects though. Amazingly, 12 to 15% of people who get Hep C clear it from their body on their own with no treatment. No one knows how that happens, but it does happen. And there are vaccines for hepatitis A and B, but not C. Any questions on hepatitis? Okay, I'm gonna let Joe take over.
All right, hi guys, I'm Joe, over at Canonsburg Hospital. Well, I'm going to talk to you a little bit about alcohol abuse and alcoholism, and then also I was going to do a whole thing on drug use, but I kind of focused it more on like psychiatric medication. Start off here, give you a definition of alcoholism. It's technically considered a medical disease, and it means to participate in compulsive or uncontrolled consumption of alcohol. Alcohol abuse, on the other hand, is similar, but it has a little bit different definition. And it's the recurring use of alcohol, despite its negative consequences, whether it's affecting your health, your relationships with other people, or your ability to work and function in the community. According to the National Institute on Alcohol Abuse and Alcoholism, men are at risk for alcohol-related problems if their alcohol consumption exceeds 14 drinks in a week or more than 4 drinks a day. Women are at risk if they have more than 7 drinks a week or 3 drinks a day. And your regular drinks are considered a 12-ounce beer, 5-ounce glass of wine, or an 1.5 ounce shot of any kind of distilled alcohol. I mentioned some alcohol issues that people have, or some alcohol problems. Can anybody name some physical problems that can come from alcohol abuse?
It can actually affect a lot of the organs, the liver mainly, kidneys, stomach, pancreas.
What's that?
It affects the mind and the heart.
What were you going to say, Becker?
Weight gain?
Yeah. You guys pretty much nailed it there. I mean, when you abuse alcohol for a long time, it comes with a lot of effects. It affects pretty much every organ, like you mentioned. You said it affects the liver. You can get cirrhosis from it. Pancreatitis, you mentioned that. You can have seizures. It can cause a seizure disorder. You can get dementia. You said it affects the brain.
It could affect, drinking too much extremely sick.
That's why I was going to get that a little further.
Some people drink too much, that's why they kill themselves or they're bedridden in the hospital.
You guys know what dementia is? That's where you
I heard of it.
You forget things. I come tell you my name, and then 5 minutes later you won't remember it. You'll forget stuff from your past, things you've done.
They forget drugs.
Alcoholism, it can cause nutritional deficiencies. It can affect your nutrition. It can cause sexual dysfunction, and it can eventually even be fatal. It can affect your heart.
It can make you.
It can cause cancer.
Dizzy or make you feel like you're in a daze.
And of course, it increases the likelihood of accidents. If you're getting in a fight with somebody, if you're in a car driving, or any kinds of those instances.
Or else people will even panic whenever they drink too much alcohol.
Definitely. Actually, women develop complications faster than men. Some of the things that happen to women, it can it can increase the chance of breast cancer.
It could be fatigue too. The I mean, it's easier for a man to drink more than a woman because it just seems like when both, you know, and after a while, it will make it kind of weary.
Yeah, it affects the women a little bit quicker than, you know, the men. Like I said, it increases breast cancer, and it can also affect their reproductive functioning, you know, their ability to have children. Some other effects that can affect you psychologically. Any kind of guesses? You know, I mentioned dementia, but
You drink
If
too
you
much,
have,
it'll kill you.
if you have like, more like, as far as, maybe like, your mood swings and stuff like that,
definitely.
it can affect your mood swings if you're autistic or something like that. If, like I have two autistic foster brothers, and they are not allowed to drink, and they're 30 years old.
Uh-huh.
And if they do, it really is trouble for everyone in the
Uh-huh.
house, and it's scary.
Oh yeah, definitely, definitely.
Yeah, because they could have a split personality. They could be nice to one person and being mean as hell to
Oh
someone
yeah,
else.
yep. Just in that quick.
Yeah.
Actually, alcohol's it's seen in about 10% of all dementia cases and 25% of all psychiatric cases. You know, it includes like anxiety, depression, and panic disorders. A lot of people you see with some psychiatric disorders, you'll see them trying to self-medicate, and by doing that, they drink alcohol. Maybe they are depressed, so they'll drink more. Maybe they have anxiety, they'll drink to help relieve it. And really, all it does is make things worse.
It'll make them more miserable when they drink.
Exactly. People with schizophrenia, panic disorders, like I said, bulimia, or any.
So a lot of people have a hard time handling life,
Mhm.
and that's why they drink.
Yeah, exactly, and it only makes things worse.
There's also correlation between alcohol use and spousal abuse.
Absolutely, and I was going to get to that a little bit further. Yeah, but definitely. Another thing, post-traumatic stress syndrome. You know, people have experienced traumatic situations. They tend to lean on alcohol, and that's the kind of stuff only makes things worse. On to social effects, as she mentioned. An increase.
And they think it's going to help their problems. It makes it 100 times worse.
Alcohol increases the risk of criminal offenses, child abuse, domestic violence, rape, burglary, assault. It's associated with loss of employment.
They're kicking people's doors down,
Yep.
stealing people's jewelry.
You know, it can lead to legal consequences, criminal charges for drunk driving, all that stuff, you know. Like I mentioned before, fighting, you know, alcohol is involved in that a lot. One of the, you know, scariest things with alcohol and alcohol abuse is when people become accustomed to it and they become addicted.
Yeah, they want to.
They keep.
I mean, they want to fight with someone. I mean, they're ready to plow someone and knock them down.
What happens a lot of times is their body becomes accustomed to it and they need to keep drinking and drinking. And then if they're not able to drink, they go into into a withdrawal.
They can get it. I mean, they can get physically. I mean, they could attack it physically.
One of the scary things with the withdrawal, though, is when you're addicted to it, you can have things that are called, they refer to them as DTs. They're called delirium tremors, where you can shiver, you can go into convulsions, pretty much have a seizure. People have nightmares, they hallucinate, and it's all when you're coming off the alcohol. Your body's used to it. When it's not getting it, it kind of goes into almost like a survival mode, and it doesn't know how to react without it. Like I said, it causes hallucinations, high blood pressure, you sweat, your heart rate goes up. These usually happen after about 2 to 3 days after your last drink. So you know sometimes people go in the hospital, they won't be able to have a drink. If they get arrested from public disorder or something, they go into jail, they won't have a drink, and they'll experience these delirium tremors. Anybody have any questions on the alcohol part of the tremors or anything? No? Next part I'm going to talk about here is the psychiatric medication. And these are basically medications that are prescribed to treat any kind of mental disorder that someone might have. There's 6 main groups of these. You have antidepressants. They treat depression. Some of these medications are Prozac, Paxil, Celexa, Zoloft, Cymbalta, Wellbutrin. Those are some of the main ones. You have stimulants, which they kind of are used to treat ADHD, ADD, narcolepsy, people that fall asleep frequently. They're also used to suppress appetite. Some of those supplements are caffeine, Ritalin, Adderall is a popular one. Antipsychotics is the next category. And they treat psychosis, people with schizophrenia or any kind of manias. Some of those drugs are Haldol, Zyprexa, Seroquel. Next little category is mood stabilizers. They treat bipolar disorder or schizoaffective disorder. Some of those are gabapentin, Depakote, Lamictal. Any questions on any of those or anything? Okay. Then you have the anxiety medications, which are used for anxiety, which are Valium, Ambien, the Xanaxes, Klonopin. The things with all these medications I mentioned and all these disorders, they can have a lot of side effects, and people tend to overuse them. So a lot of people, like I said, they use them more than they should. Doctors prescribe them for certain times, certain frequencies and all that stuff, and it's really important that people do follow those because they do have interactions and they can have negative effects too if people overuse them. I have a couple handouts here.